everyone, welcome from whichever place you are watching from. Welcome back to this episode on knowing your health better and knowing some of the tests that are done in our clinical labs and how they are interpreted and what they say about your health. In our today's topic, I'm going to talk about one of the most common routine tests that are done in our clinical laboratories today. If you walk to most of slightly advanced health facility, say from level 3, level 4, one of the most common tests that will always be ordered is a complete blood count. Complete blood count. Complete blood counts just try to show the count or the number of cells that are within your blood. Your blood is made up of blood cells, and in your blood we have the red blood cells, we have the white blood cells, we have the platelets. So under these three categories there are some indices that are also under them, and some cells, for example in white blood cell, that are equally important and also helps in diagnosis and trying to determine whether you have an infection or not. But in our today's topic, I'm going to focus on the red blood cells indices, because most of the time after we have produced a full hemogram report, that is the complete blood count, I normally see in many occasions the doctors focusing on the count of the white blood cells, the count of the red blood cell, and the count of the platelets. And in many cases, they will try to check also the neutrophils as parts of the white blood cells, and sometimes try and check the basophils and eosinophils, all that depending on the machine where the report came from, whether it was a 5-part or a 3-part machine. But for the case of red blood cells, the major focus is normally the hemoglobin levels and the red blood cell counts. However, there are some indices under the red blood cells count that are equally important in trying to come up with diagnosis, especially in cases of anemia, because anemia are of different types depending on whether the causes are nutritional, whether the causes are genetic, or whether the causes are due to a problem in your bone marrow. All those instances, there are possibility that you can have anemia. And did you know also that you can have a normal HB level, yet you still have a certain type of anemia, and therefore your red blood cells therefore cannot perform their function to perfection due to that. That is why these indices, there are around 4 or 5 indices, are equally very important in your full blood count report. Normally a complete blood count is measured using an automated hematology analyzer. And this automated hematology analyzers, the count of your white blood cell will measure the count of your red blood cell, will measure the count of your platelets, will measure the count of your hemoglobin, and under red blood cell also it will help in measuring your hematocrit, or the dark red cells. After that, under the red blood cells, we have got some 4 indices that it will also calculate and give you the report about them. When I talk about hematocrit, I know most of you know what hemoglobin is, what red blood cells are, what white blood cells are. But now when I talk about hematocrit, that's the fraction or the volume of the blood that is occupied by the red blood cells. The fraction of blood that is occupied by the red blood cells is what we call hematocrit. So using this hematocrit, your hemoglobin and your red blood cell count, you are able to calculate some of the important indices in diagnosing anemia. And one of the important indices that will be indicated in your full blood count report is the mean corpuscular volume. The mean corpuscular volume. The mean corpuscular volume is just the average size of a single red blood cells. The average size of a single red blood cells. And normally, a normal red blood cells should be up to a certain size, should have a normal size in order to be able to perform its function correctly. So the mean corpuscular volume in your report will indicate whether your red blood cells are of the right size, whether they are too small or too big to perform their function, or they are perfect in their size in order to perform their function. And the size averagely is normally around from 80 to 100 femtoliter. A value of red blood cells that is lower than 80 is considered microcytic, and that is abnormal. And a value of red blood cells that is greater than 100 is considered macrocytic, and that also is abnormal. You now understand why you need also to consider these red blood cell indices. Now, you can have the correct number of red blood cell count averagely within the normal range, but most of them are microcytic or microcytic. Most of them are small and others are bigger in size. That's why when you just assume from your normal RBC count that everything is okay, then you are totally wrong. So when you check the mean corpuscular volume, the MCV, you'll be able to tell whether you are dealing with quite a number of small size RBCs or large size RBCs. Small size RBCs are normally common in conditions like iron deficiency anemia. They normally are one of those things that leads to you having a microcytic, a lower MCV. However, in conditions where you have megaloblastic anemia, that is anemia due to lack of vitamin B12, you will have a higher MCV, a large red blood cell, and that is considered macrocytic. So in such situation where the MCV is high, you start suspecting things such as megaloblastic anemia due to lack of vitamin B12. A normal red blood cell is considered normocytic. That is in terms of sizes, in terms of MCV. An MCV that is 800 to 100 within the normal range is considered normocytic. When it is below the normal range, that is the red blood cell, it is considered microcytic. And when it is bigger than the normal size, it is considered macrocytic. And it's very important in trying to categorize these types of anemia, and that will help you in determining the type of management rather than just rushing into transfusion and all that. At least you will know where the problem might be. That is indices number one. Number two, we have mean corpuscular hemoglobin. The mean corpuscular hemoglobin, which try just to tell us the average volume of hemoglobin in a single red blood cell. The average volume of hemoglobin in a single red blood cell. However, mean corpuscular hemoglobin alone is not enough in trying to come up with this diagnosis. That's why we narrow down to another indices called the mean corpuscular hemoglobin concentration. And this mean corpuscular hemoglobin concentration will just try and tell us the percentage of hemoglobin that occupies the red blood cells. The average volume of hemoglobin, the juicy part of red blood cell, is made up of hemoglobin. That is what the mean corpuscular hemoglobin concentration will try to tell us. Each normal red blood cell should have 2/3 of its content occupied by hemoglobin and 1/3 made up of central part. That's why when you try to check for a red cell in a microscope, you'll see that most of the 3/4, the outer part, is quite red, because that's what gives the red blood cell its color. It's made up of hemoglobin. Then there's a central part which is like a third that is not that red. So that outer part is what is made up of. It's made up of the hemoglobin, and it always occupies 2/3 of a normal red blood cell. So this one is calculated using the hematocrit. Remember, the machine gave us the hematocrit, the red blood cell, and the HB, and it uses this to calculate all these indices. We have the MCV, mean corpuscular volume, corpuscular hemoglobin concentration. Those are 3 indices that we have discussed. Now, a normal red blood cell has an average of about 33% of it occupied by the hemoglobin. And in that case, we refer to that cell as normochromic cell. So a cell should be normocytic, meaning it is of the right size, and normochromic, meaning the hemoglobin content, it is also of the right amount. Now, in cases whereby the mean corpuscular hemoglobin is low, below the normal range, is below less than 2/3 of your red blood cells, then we refer to that cell as hypochromic. And hypochromic is also common in cases such as iron deficiency anemia. But a cell which has got almost the entire content occupied by hemoglobin, forming a shape that is almost like a sphere, like a sideroblast. Almost everything is captured by the hemoglobin, and the cell now loses its biconcave shape and becomes more of a sideroblast. Then we refer to that cell as hyperchromic. And hyperchromic is common in conditions such as sideroblastic anemia. Now, up to that point, we have discussed 3 important indices in your red blood cells: mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentrations. Another equally important indices of your red blood cell is what we call the red cell distribution width. That is also indicated in your full blood count report. The red cell distribution widths normally try to tell us how your red cell is, how your blood contains red cells that are quite varied in terms of shapes, whereby we have cells which are microcytic, cells which are microcytic, we have small one, we have large one, something like that. That is what the red cell distribution width. Remember, a normal one should be about 90 femtoliter. So the red cell distribution width, when in your report you have a very high red cell distribution width, then it means that your blood contains a varied number of red blood cells. A varied number of red blood cells that are different in terms of shapes and in terms of sizes. We have got microcytic cells within the red blood cell, and we also have got the microcytic, and we also have the normal cells. That's what a high red cell distribution width tries to tell you. So when you take this red cell distribution width together with the MCVs and MCHC, you are able to determine whether your anemia is of nutritional cost, genetic cost, or it is of a cost in the bone marrow, or any other type of cost. You are able to distinguish whether you have a normochromic anemia, or whether you have a normochromic normocytic anemia. This is a situation whereby your red cells are normal, your hemoglobins are also okay in terms of sizes in each red blood cells. And in such cases where your red blood cells are normal in terms of size, your hemoglobin are okay in terms of the percentage they occupy in each red cells. That is, if you check your red blood cells, maybe in a microscope, you will find that most of them are of the normal shape, yet your hemoglobin count is low. Then it means that you have an anemia that is due to a chronic disease, maybe chronic kidney disease. But when you started noticing things like small size red blood cells or large red blood cells than normal, then you will start thinking of the nutritional causes like vitamin B12 deficiency, like the iron deficiency. So using these red blood cell indices, it is important in trying to grade or in trying to distinguish the type of anemia that you might be suffering from. The type of anemia that is causing that low hemoglobin count, that might be causing that the low red blood cell count. You're able to distinguish and try to go closer to the root cause, and that helps in developing the correct management, trying to find out what might be causing these low ions in your system, or the low vitamin B12, what might be the primary cause, so that we don't just do a lot of transfusion without having the knowledge of where or what might be the cause of your anemia. So after this, I am confident and feel that going forward, you will start also taking into consideration, as you interpret that full blood count report, take into consideration the red blood cell indices and try to interpret them accurately. Try to put them into your diagnosis as well, and that will help you know or come close to the root cause of that anemia that you might be suspecting. Thank you for watching. I hope that you have learned something and you will implement so that we do proper diagnosis and proper interpretation of our lab reports. Thank you, and keep following for more.